Let's talk about substance use disorders. So when we talk about substance use disorders, substance use can be anything from alcohol. There's a whole list of them. So when I'm teaching this, I'm teaching it very broadly. So if a person abuses alcohol and becomes dependent on alcohol for a 12-month period, we would call that an alcohol use disorder. Whereas if a person abuses and becomes dependent on cannabis, we would call it a cannabis use disorder. So when you see substance use disorders, it's far broader. It's just the larger category of diagnoses, right? Now, substance use disorders in adolescence is pretty common, I would say. I would say this is when it usually starts. It can involve dependence or abuse or end abuse. When we use the word dependence, that means that in order to perform a task, the person feels that they need this substance of abuse to do the task. Where the word abuse means either using a drug that is illegal or illicit, or the drug is legal, but using it more than the prescribed quantity. So if a person is prescribed Xanax, right, and they choose to take 4 or 5 pills a day, that might be well above the prescribed dosage, and that's considered abuse. Now, we also see that substance abuse causes some level of negative consequence, right? So in the case of children and adolescents, it's going to affect your schooling more often than not. It's going to affect your whether you even show up for school, so truancy. It could result in more legal consequences, right? So these are very common issues, right? Now, we need to track this condition for 12 months, and if we don't have sufficient tracking, then we don't really diagnose you with a substance use disorder. So here are the criteria. Again, this is straight out of the DSM-5, right? So that you're taking larger amounts through time, which means that you're developing tolerance. You might have attempted to cut down, but you're unsuccessful. Now, you don't need all of these criteria. You only need 2 of them, by the way. You spend a lot of time either trying to obtain the drug of abuse, use the drug of abuse, or recover it from it. And we define a lot of time as more than an hour, similar to OCD. You have increased craving to use the drug. It results in some kind of failure to perform one of your basic tasks of life. So school-related activities, work-related activities, things of that nature. And even though there's damage to some level of your social functioning, you still continue to use, right? So these are basic aspects for a substance use disorder. So again, you don't need all of them. You only need 2 of them in order to meet the criteria of a substance use disorder. Now, it goes on. We could talk about tolerance and withdrawal. Tolerance, as I said, is either needing more of the drug to receive the same high, or using a consistent dose but not feeling the same high. A withdrawal are those negative consequences or side effects when you're no longer on the drug. So if a person is abusing, let's say they're abusing cocaine, right, and they have that high energy, they might not need sleep, similar to feeling like they're in a manic episode. But there's something called a cocaine crash, which is the withdrawal effects, where they start to feel very depressed and so forth. All right. Now, we use specifiers to give a better picture of what's going on. So if the person has started to work on the substance and they've no longer been using the drug, we use in early remission or in sustained remission. So anything that's 3 to 12 months is what we call early remission, right? Anything that's after 12 months that they haven't used the drug, we call that sustained remission. Now, we don't expect the craving necessarily to go away, right? That's kind of silly, right? But the other behaviors linked to substance use, you have to stop them, right? We also want to specify if the reason why you're not abusing is you're in a controlled environment. So if a person's in a rehab, right, that's a controlled environment. If a person's in a prison system, that's a controlled environment. So it's very important to specify why they're not using. And then, as I said, you only need a minimum of 2 of the criteria to get the diagnosis. So we have to specify mild, moderate, or severe. So any 2 to 3 symptoms is mild, 4 to 5 symptoms is moderate, 6+ symptoms is severe, right? And this goes for any substance of abuse. Now, when we look at it, the most commonly abused drug for adolescents is alcohol, right? And yes, you're going to tell me, oh, marijuana is up there too. It is, right? We see marijuana is now number 2 or number 3, if I remember correctly, right? So marijuana has increased with it becoming more available in society, and cigarette smoking is up there as well. So what's interesting, the 3 big targets of drugs are either legal or legal in some states, right? So there is a theory as to why people abuse drugs, and this theory proposes that the more available a drug is within society, the more likely you're going to abuse it. So it wouldn't shock you that alcohol and cigarettes and marijuana are your top 3, right? It wouldn't shock you at all because they're the most available. Now, alcohol usually has the earliest age of onset, and then followed by cigarettes and cannabis. That doesn't mean that kids are not using other drugs. Kids still do find a way to get other drugs. It's not as common, but they find a way, right? So things like opiates, pills, cocaine, or crack cocaine. These are still somewhat available, but they're harder to get. And then in the club scene, ecstasy. Ecstasy is another drug that's used. Now, if you were to look at the drugs, we would see that 12% of American teenagers or adolescents meet the criteria for substance abuse or dependence. That is a pretty high number. In fact, if you follow the rates of substance abuse, you're going to see that the rates of diagnosis are highest in adolescents up to about 29. By around 30, the rates start to drop, right? And that kind of makes sense when you think about it. Adolescents are trying to experiment, try and figure out who they are. So they're going to try different drugs. Alcohol is a big part of traditional college life. So alcohol rates and diagnosing alcohol use disorders are disproportionate in college. So we start to see that there's a shift that happens around 30 where things start to slow down. Now, interesting findings when we look at alcohol, marijuana, and other drugs. What percent of 8th graders are drinking, right? If you look at the rates, it's pretty concerning that it's over 20%. By 10th grade, it's almost 50%. and by 12th grade, it's over 60%. And I will tell you that doesn't mean all of these people meet the criteria of an alcohol use disorder. It just means that occasionally they abuse alcohol, right? There's a difference between abusing the drug and meeting the criteria for a disorder as well, because we don't have over 60% of 12th graders diagnosed with an alcohol use disorder. It's much less. When it comes to marijuana, you see that the rates are climbing with age as well, and then the other drugs are climbing with age as well. But I think this graph tells a story, because if you are going to diagnose a child with a substance use disorder, the usual diagnosis would come from either alcohol use disorder or a cannabis use disorder. It is much less common, or far less common, for things like cocaine or whatnot. Even opiates, where pills are more available than, let's say, crack cocaine, it's still in single digits, the rates of diagnosis, whereas the other ones are much higher. So, age of onset. Now, we do believe that some of the experimentation with alcohol and other drugs is normal during adolescence. We're not saying we want you to do it, but we expect you to, right? You're going to try things out. Now, what is concerning is when you have your first exposure. So we see the earlier the exposure to a substance, the greater the risk of developing a disorder related to substances of abuse, right? So, for example, I guess the last bullet point says it, that um, if you start drinking before 14, you're at greater risk of developing an alcohol use disorder. So that is of importance. All right. So every year you delay exposure to substance of abuse, the less likely that person is going to acquire a substance use disorder. So we know kids are going to experiment, but my recommendation to you is not to make it easy on them, not to be that parent who says, my kid's going to do it anyway, I might as well do it with them. And there are parents out there that use that logic, and it is horrible logic, because the earlier you expose a kid to these substances, the more likely they're going to abuse. All right. So, in terms of gender differences, we do see that males tend to have higher rates of most substances relative to females, but the gap is closing. We also tend to see, in terms of substance use in general, African American youth have lower usage rates than their white counterpart. And then across a lifetime, we see Hispanic individuals have the highest rate of use of cocaine, heroin, and methamphetamine. So there are ethnic differences there too. So now, what's interesting is we don't talk about the problem of Indigenous Americans. Indigenous Americans actually have the highest rate of all communities as it relates to substance use. Now, when it comes to alcohol, for sure, it's the highest rate, but even other drugs, we see Indigenous American or American Indian, Alaska Native individuals tend to have the highest rates. Can you think of why that might be? Why is it that our Indigenous communities have highest rates? Anyone? Okay. So I'll answer it. Indigenous communities have the highest rates because uh, imagine what it's like to be dispossessed of your land, right? Um, Imagine what it's like to be living on a reservation, right? And the pressures of life that Native Americans tend to experience that you or I may not experience the same degree, it are great, right? So feeling isolated, feeling uh, misunderstood, feeling invisible, feeling like you know the majority culture disregards you. All of these factors can play a role in substance use, and that it does put um, indigenous communities at higher rates in the United States. So when we look at the rates of substance use, I think I told you this, the rates peak around late adolescence and decline during young adulthood. By 29 or 30, it really starts to drop off. We see alcohol use does create greater tendencies for other risky behaviors like unsafe sexual activity, drinking and driving, smoking, things like that. We also see dating aggression is much higher amongst people who are drinking relative to people who are not drinking. So we have to be very careful with how alcohol results in dating aggression, both in males and females, right? So you'll see that it's 5 times more likely for girls and about 2.5 times more likely for boys. So dating aggression and alcohol are a significant concern. So other associated characteristics. Well, more often than not, people are not just using one drug. Now we're using alcohol as a drug. We're using tobacco as a drug. We're using cannabis as a drug, right? So it's possible for a person to have polysubstance use. And so that's what we mean by more than one substance simultaneously. When that happens, it's also not uncommon for you to struggle in the classroom and skip class and not pass your class. We also see more parental conflict, which is interesting because the parental conflict can result in a substance use, or the substance use can result in a parental conflict, right? There could be some neurological or neurodevelopmental issues, ADHD, conduct problems. These are all associated characteristics. In terms of personality, you're going to see a novelty preference. So there are some people who are thrill seeking or novelty seeking. So they're going to be more likely to abuse drugs and alcohol. You see people who have friends who have substance abuse. They tend to have a positive view about substance use. A person who views himself as older or more mature than their age mates are going to be more likely to have substance abuse problems. You see people who are disconnected with their academics as more likely to have substance use. Now, the family, we talked about the family. Lack of parental monitoring is a big factor here. If you are not keeping an eye on your kids, they're going to find drugs. So if you just say, "Oh, they're teenagers, let's let them do what they want, let them become more independent," that's not a great idea because lack of parental involvement increases the risk of substance use. Now, we also see lack of trust between female teenagers and their parents as a predictor. Now, in terms of culture and peers, you might hear peer pressure or false consensus. Everybody's doing it. Hanging out with peers that are engaging in deviant behavior is going to increase the risk. And if you see in social media or you see on movies the glamorization of partying, then you're going to be more likely to party. So, how do we treat it? Well, with children, adolescents, we definitely want to involve the family and we want to target communication. We want to reduce conflict in the family and any kind of negative interaction between family members. We want to target that. Now, in general, there is a form of therapy called motivational interviewing, which comes out of the Rogerian model or client-centered approach, where we basically work with a person where they are, and we help them develop increased motivation for change. So I'll give you an intervention or an example for motivational interviewing. You might do what's called a scaling question, where you might say, on a scale of 1 to 10, how much do you want to stop drinking? So you might have a person say, oh, I want to stop, and I'll rate it at a level of 3. Now, 3 is a fairly low motivation for change. But to put things in context, you might ask them, I heard you say 3, why not 1 or 2? And that invites them to talk about reasons for changing. And then you might ask, okay, you're at a 3, but what would it take to get you to a 4 or a 5? So you're using that ruler or scale to try and reorient them to increase motivation. Now, if you have abuse, neglect, maltreatment, if you have unstable living in conditions, if you have other mental health problems, um, that increases the risk of uh, using drugs. In the most severe of cases, you might have to use a rehab, which is a residential setting or an inpatient setting. So, in addition to talk therapy, it is possible that some people need a higher level of care. And if a person is not responding to weekly psychotherapy, you might increase the frequency, but at a certain point, you're going to say, yeah, no, this is not working. The abuse is too much. They don't have a stable living environment. It's too much. So we might say, okay, let's try a residential approach. Now, we also want to target every modality that we can. So we want to target their peer group, right? So if you are hanging out with friends who are using drugs, we might encourage you to reassess your relationship with your friends, see, what value does it have, and whether maybe certain people are bad influences. We we talk about the family things already. We talked about school, and we also have to assess community life because the environment plays a role on what you choose to do as well. So I have covered everything that I wanted to cover for today. So I'm going to stop the recording. Now, your test will be next week. And yeah, I covered everything for the test. So let me stop the recording.